Hello, my name's Florence. Welcome to the OBS Pod. I'm an NHS obstetrician, hoping to share some thoughts and experiences about my working life. Perhaps you enjoy Call the Midwife, maybe birth fascinates you, or you're simply curious about what exactly an obstetrician is. You might be pregnant and preparing for birth. Perhaps you work in maternity and want to know what makes your obstetric colleagues tick, or you want some fresh ideas and inspiration. Whichever of these is the case, and for that matter, anyone else that's interested, the OBS Pod is for you. Episode 86, Decades. New Year. It's a reflective time of year for many people, myself included. This time last year, I recorded an episode 37, Resolutions. I even listened back to it this week because I was struggling for inspiration. My podcast is usually energising, something I very much enjoy creating. But sometimes I hit a block. I'm just not feeling it, as my kids would say. Maybe this year it's because 2021 has been strange. This time last year we had high hopes. We had the vaccine. I almost wept with relief when I was given my first dose. Yet here we are, a year later. A step forward, it's true, but far from in the clear, far from through this pandemic. I'm finding it hard, as 2022 approaches and dawns, to feel optimistic, particularly when it feels the last 2 years, 2020 and 2021, have blurred into a strange, timeless mashup of a year. It's been confusing, things that traditionally happen at one time of year, happening at a totally different time. The rhythm of life as we know it being quite disrupted. And then add to that the confusion of the 2020 Olympics and the 2020 Euros retaining their names despite being held firmly rooted in 2021. It felt important to me to start the new year in a better frame of mind, with a more positive outlook. And then inspiration struck. There was a recent tweet from one of my listeners, Ruth Anna, who's just started as a consultant in O&G. She commented on the difference between where she was a decade ago, with a 10-month-old doing her training at 80%, and where she is now, making the transition to the role of consultant whilst bringing up her family of now 3 children. Her tweets made me pause for thought. What was I doing a decade ago? And indeed, as I'm significantly older than Ruth Anna, what was I doing 2 decades ago or even 3? And more importantly, what, if anything, can I learn from my nearly 3 decades in the NHS? Therefore, today, I'm taking a little trip back in time to reflect, to pause, to think. Back in 1992, 30 years ago, I'm a medical student. I'm approaching the end of 6 years of medical training. My passion for obstetrics has already been ignited, and I've just spent my UK elective doing an additional O&G attachment. I'm planning my elective abroad. And in the dying embers of the year, on New Year's Eve in fact, I have got engaged. My future is bright and exciting. I'm about to become a doctor, something that I've wanted to do since teenage years, and I'm planning on getting married. A decade later, in 2002, I'm on the brink of giving up the career I love. I'm successful. I've made it to being a middle grade registrar. I've competed to get the elusive training number I need and getting positive feedback. I've passed my professional exams, my membership of the Royal College of Obstetricians and Gynecologists. But the combination of long hours of work and being the mother of 2 small children, age 1 and 3, is too much. Even with flexible part-time training and immensely reliable childcare, I feel I can't give enough. I can't stay late. I can't compete. I can't throw myself into being the super keen trainee every time there's a work opportunity. I have to trade it off in my head versus my home commitments. Maybe I'm starting to realise that contrary to what I've been led to believe, maybe I can't have it all. Maybe I can't have a career and motherhood. Fortunately for me, I have a really sensible supervisor who twigs during a conversation that something adding hugely to my stress levels is the long commute across London. She suggests I explore an interdeanery transfer. Maybe a shorter journey to and from work would help me. Not long after, an appointment at a hospital 15 minutes from my home with a consultant in charge of trainees in my local area, and it's agreed. And right at the end of 2002, I start. It transforms things sufficiently for me to keep going. It's tough. It's still very challenging, but it's manageable. I can get by during those early years of my children's childhood and maintain that career, that vocation that I've fought so hard for. Ultimately, it turns out I've found my work family, my work home. This hospital, where I start in 2002, is where I spend almost all the remainder of my training. And 5 years later, I have a consultant post at that same hospital. And 20 years later, I'm still there. Personally, for me, therefore, 2002 was a very defining year in my career and personal life. Practice-wise, what was happening? We were still in the aftermath of the publication of the Hannah term breach trial, which had been published in 2000 and hotly debated through 2000 and 2001. A gigantic shift into caesarean for all breech babies had taken place. And it seems extraordinary to consider that that's now over 20 years ago, 2 decades. That practice change has had profound implications for people's confidence and skill in breech birth. And I've talked about this in far more depth in my episode Bottom Down. Moving on now, 2012. I'm a consultant, I'm established. Not only that, I'm leading a service. I'm clinical director. I feel confident and competent. I enjoy my work. Some of the challenges that year are slightly more unusual. It's London 2012, the Olympics. We have to adapt to the idea that we'll have Olympic athletes cycling past the door of the hospital. For the cycling road races, we're almost an island, with cyclists coming past one entrance at one leg of the race and coming back past us again at a later point on their way back into London. We have to consider how women will be able to access our maternity service during the race. We have to forewarn the women that are pregnant, give them instructions, think about calling women in labour in earlier with our triage midwives, giving instructions about how to get through roadblocks and security. At the time, it seems insanity to run a major sporting event past a hospital. I clearly remember working on the day of the Olympic women's cycle road race. I had to arrive at work early, use a special pass to get through security. I remember feeling immensely sorry for the athletes, as, like a London summer, it pelted with rain. Having done it for the Olympics, it's become the new normal. Every year, apart from during COVID, Ride London comes past our doors. Elite athletes cycling, followed by many cycling enthusiasts, amateurs. Over the years, many of my consultant colleagues have participated, raising money for the hospital charity. I've worked on race day a number of times. If we can track their progress, we'll pop down and wave at them as they shoot past with homemade banners, trying to inspire them. For some reason, it feels like it makes the hospital part of the community, part of the geography. And back in 2012, just like the rest of London, the hospital is infectious with Olympic fever. People are taking random days holiday to go and spectate, see an event, come back, rave enthusiastically. One of my colleagues manages to volunteer. A GP I know acts as a volunteer medic. The hospital becomes swept up in the excitement, just as the rest of the country. Aside from the Olympic excitement, one of the key things I remember that year is the tedium of CNST. This stands for Clinical Negligence Scheme for Trusts. This is to do with how we're performing against our guidelines and the CNST assessment process to decide what premium we might pay to our insurance, NHS indemnity, and the level of accreditation, as it were, for our service is determined by a mammoth inspection. CNST at that point was becoming an industry in itself. Many maternity units had to appoint specific CNST midwives who would spend hours writing guidance, auditing notes, getting everything ready to be presented to the assessors. It became a massive, mammoth task. It ended up taking midwives away from the clinical workforce to work on passing the test, as it were. And for that reason, thankfully, it did get changed and it did get reformed. But much of my 2012 was running meetings, checking where we were at in our preparation for our CNST assessment. And I know I wasn't alone. This was a massive problem for many maternity units at that point in time. The major practice change that sticks in mind around that time is the change in the NICE caesarean section guidance, which was published in November 2011. For the first time, this guidance suggested that if a woman was requesting a caesarean and her obstetrician did not feel they could agree it, that they should refer to an obstetrician who would. This was a major milestone. Effectively, this started caesarean on demand. Many maternity units did not adopt this immediately. Indeed, it's still a controversial issue today. But it was a seismic shift in thinking. I think it was a major step in a change from a very paternalistic view of medicine, where if a woman came and asked for a caesarean, we knew best. We would explain to her why she shouldn't, into a more balanced, nuanced conversation where we gave a woman information and she made her choices on the basis of that. At the time, it was radical thinking, and I'm not saying we didn't do caesareans for maternal requests before. We most certainly did. But the publication of the guidance immediately, overnight, increased the number of women asking for a caesarean birth. It was such a big change in thinking that one of my junior colleagues and myself wrote an article about it for a journal about the ethics of maternal request caesarean section. Not just the ethics of can a woman ask for surgery to be performed, but also what are the ethical rights of the surgeon? Are we mere technicians? Is it acceptable for us to be asked to perform surgery where we're concerned about complications and for which we have the responsibility of performing the surgery safely when we know that that surgery wasn't strictly necessary, in inverted commas? I know some of my colleagues, particularly midwifery colleagues, were very distressed by the publication of this NICE guidance, the ultimate medicalisation of childbirth. And when I look back on it, a lot has changed in the last 10 years about our attitudes to women asking for caesarean birth. But this major change in guidance has had a big knock-on effect on the numbers of caesarean births we perform, and therefore the staff and the facilities we need in terms of maternity theatres and equipment. So now it's 2022, and as I pause and think about that, it's incredible to think that all the work I've done with maternity experience, or MatExp, has been in the last decade. I feel as I've become a more experienced consultant, more senior, more confident, more respected in my practice, I've been able to experiment more. The last few years have given me freedom to develop and be creative. I'm probably less ambitious and driven than I was a decade ago. I don't have to prove myself quite as much. I can take it or leave it. To a degree, I can explore what interests me. And in general, that means pushing myself beyond my comfort zone, exploring new ideas and thinking and new perspectives. And that's how I've ended up here with a podcast. I never imagined that I would see a major pandemic like this in my medical career. Let's hope that 2022 brings some resolution to that. In the last year, I've had to learn how to look after pregnant women with severe COVID and the knock-on effect that's had on both their health and the potential preterm birth of their baby as a result. Okay, what's my New Year zesty bit? What's my message? What's the point? In the NHS, a lot of us stick around for a long time. There are long service awards for 25, 30, 40 years, and it's not unusual for many members of staff to receive them. We don't tend to change jobs in quite the same way as people in other professions do. I remember when I became a consultant, I imagined that was it. I'd reached the peak of what I was aiming for, and I was slightly concerned about the years stretching ahead of me being a consultant. Would I get bored? My zesty bit today is, whether you're a midwife at the beginning of your career, or one at the end, or whether you're an obstetrician, actually, even though you're in the same job, it may be that you change rather than the job changes. Yes, the job develops. Yes, people that have been knocking around a bit longer, who may seem a little bit out of date or fixed in their ways, can help us by telling us what's gone before. They've got a knowledge and experience that a new person hasn't. But you won't get bored because you will change and develop, just as practice changes and other new things come into play. And some of these things I've learned will be unexpected, such as the pandemic or me having a podcast. And if you're a parent or pregnant listening to this, then yes, parenthood or the birth of that baby will change things, will change your family, will change you. But it's an adventure. Be curious, embrace it. Try and gather some wisdom from the people around you that have been around a bit longer. How did your parents parent you? How have your siblings or friends become parents? What are their tips? What are the things they'd actually avoid? What lessons can they share with you? And listen to those midwives, doctors, support workers, health visitors, people around you to support you on your journey. Because yes, you are still you, but you're going to come out of it a different you. The me in 1992 is not the same as the me in 2022, but in a good way. I hope that some of my podcast will help you on some of that journey. I've got some fantastic ideas for episodes and also some great guests coming up in 2022. So I'd like to wish all of you who are joining me on this journey a very happy new year and start of 2022. I do hope you've enjoyed listening to this episode of the Obs Pod. Feel free to contact me on Twitter at FWMaternity or at the Obs Pod to ask me questions, give me topics for future episodes, or let me know what you think. It's absolutely fantastic when you get in touch. I really enjoy reading your comments. As usual, I've tried to include in the programme notes some extra reading about this particular topic, both for professionals working in maternity care and for pregnant women using services. I'd like to reassure you that although I'm talking about my experiences working in maternity care, I take confidentiality very seriously and do not give any personal information about any of my patients. If you've enjoyed listening, I'd love you to recommend the Obs Pod to friends or colleagues, and please do leave me a review on whichever podcast directory you find my episodes. Many thanks for listening.